everyone. Welcome to Vita News. I'm Michelle, the Vita specialist for UK and Ireland. Today's topic is on disinfection, care and hygiene while using your shade guides in your dental clinic. I have with me Dr. Gulshan Murgai from London. Hello, doctor.
Hi, Michelle.
Dr. Gulshan runs his own dental practice in North London called Skin and Smiles, and he's also a dental CAD/CAM laboratory owner. How are you, Gulshan, today? Welcome to Vita News.
Thank you, Michelle. I'm really well, thank you. Obviously, difficult times, challenging times with the current situation, but we're doing our best to rise to it and support our patients in a safe way, yes.
I understand it's a real challenging time right now. But going back to, of course, what we just said, is most of the dental clinics now, especially in the UK, have now started opening up their practices, and some of them in different countries are now planning to reopen their surgeries. How are you and your team preparing at the moment?
So it's different for every practice. In the UK, we have had specific guidance, and there are different types of practices that are doing things differently. However, what we've all had to do is to put in place a written standard operating protocol, otherwise SOP, okay? So we all had some guidance as to what that must include. It's all about the safety of how we are treating our patients, but also how we are ensuring that our support staff and ourselves are kept safe. Now, if you look at the wider picture, when we all go home to our loved ones, it's also about ensuring that when we do go home, that we don't take home any of the germs that we may have picked up during everyday practice. Now, of course, we've all been doing that in the past, but with the seriousness of the COVID-19 situation, obviously that's really brought things home as to what we might do differently. So every practice has done a standard operating protocol. In our case, we call it the revised patient journey, because we've considered what it's like for the patient from the point of contact, from the point of making appointments, attending, what might be different in the building as to how things look and feel, and then of course how we might undertake the treatment differently. Some of them are not used to us seeing advanced PPE being worn, so PPE being personal protective equipment. So that's the kind of thing that we're doing. We're doing the same dentistry, but in different ways.
True, I understand. But we just said about dentistry, of course, taking a different step. And we all know that dentistry is going to open, of course, phase-wise. Yeah, so it's the emergency care before, and then later on restorative work, crown and bridge. And especially with Vita, using the Vita shade guides in your clinic. I'm aware you have almost all the shade guides. You've got the Vita classical one, yes, the Vita 3D linear guide, 3D master linear guide, and of course the Vita shade taking device called the Easy Shade. So what measures are you going to take for your clinic, of course, in using these shade guides?
Okay, thank you for the question, Michelle. So we're in week 3 of opening after COVID. So in the first 2 weeks, we spent our time dealing with the emergent situations, with people who had incomplete treatments, and with people who contacted us during lockdown who unfortunately we were unable to see. So we've dealt with those people, some of whom required CAD/CAM restorations and so on. So you're absolutely right. We have all of the shade taking systems. So we have the standard Vita Classical, which many people will recognize worldwide. We have the Vita 3D Linear Guide, which is presented in a box like so. And we also have invested in the digital shade taking system. So this is the Easy Shade version 5. I actually have a version 1 as well. So recently we purchased the version 5, and we use that in conjunction with the app that Vita created for really communicating shades accurately to our laboratories. So yes, we have them all, and we use them in different circumstances. So we may use the classical guide in circumstances where a technician prefers that, where maybe they're using a porcelain, which they only stock perhaps in the classical shades. We then are using the 3D Master with its extended range when we're doing I would suppose when we're doing our chairside
CAD
CAD/CAM,
CAM restorations.
and when I'm in control of the milling, and the blocks that I tend to use are from the 3D Master shade selection system. With regards to the Easy Shade 5, well, often we use that in conjunction with the, let's call it the analog systems. So we would use this as well. It's a great way of getting the patient involved in their shade, in showing them how we're going to communicate that to the lab, and it gets them, you know, invested in the whole process. So just because we're in this difficult situation right now doesn't mean that we should be shying away from the investments in our knowledge and our equipment that we've purchased for our practices. We should still be educating our patients as to what we're doing for their benefit.
That's absolutely right.
So would you like to know a bit more about what we're doing with regards to the cleansing now?
Yes, please, Gulshan, that would be
So
helpful.
let me go through that. Firstly, really, really important to tell you guys out there that Vita have a procedure, protocol, so to say, for the cleansing of all of their devices. And each one of their devices, whether it's the classical or the Easy Shade 5 digital system, will have instructions for use that will come with it. Okay. Now, people are asking, well, should we be doing anything different? And if so, what with respect to the COVID situation? So it's really important that it's well known COVID-19 can be killed with isopropyl alcohol. So wiping either the carrier or the actual shade tabs with isopropyl alcohol and then letting it evaporate is more than adequate to kill COVID-19 or any other bacteria or viruses that may be on the surface. Likewise, with the Easy Shade 5, the entire handle that you would hold with a gloved hand, let's say, can be wiped down. It then has a disposable cap, like so. Can you see that there, Michelle? So you get packs of disposable caps, single use, obviously, and then it's very easy to apply them and then put them in the dustbin afterwards. With respect to the linear system, which is obviously a larger case, you would never ever put the case or any of the plastic carriers into the autoclave. But what I can tell you is the tabs, the metal-based tabs that are within each of these systems can safely go into the autoclave, okay? So there are two different cycles that you would choose from. There is the so-called gentler cycle, which is 121 degrees Celsius, and that cycle would be for 30 minutes. Or there's the more standard cycle in the autoclave, which is 134 degrees, that you would run for 4 minutes. That is the specified time for being able to say that that particular product in that cycle has been sterilized, obviously under steam penetration. Now, like with anything that you would autoclave, whether it be a hand instrument, a diamond burr, anything of that sort, the more cycles it runs through, the more it will degrade. But as I say, Vita has ensured that these particular products can go through several cycles safely in an autoclave. Now, it may be that what you do for speed, because autoclave cycles can be anything up to 3/4 of an hour, it may not be practical to put these through an autoclave cycle repeatedly through the day if you're doing a lot of restorative. So it may be that your support staff will wipe them and ensure that they've been allowed to dry of isopropyl alcohol through the day, and maybe then at the end of the day or at the end of the session that they become autoclaved. I think that's a good way that you could ensure in your protocols that safety is being maintained at all levels. How does that sound?
That's really good, of course. And if I have to ask, Gulshan, are you doing anything different compared to before, earlier, or now with the hygiene in terms of using these shade guides, or it's something which you always followed and carried out in your practice?
Okay, so let me tell you, with respect to cleaning these particular items, no, we don't need to do anything different because they've always been cleansable items. And really what we're doing is just educating our support staff, making sure that they know that they've always had a protocol in place to keep these safely clean. What I will say that's different is that because we are having to be very careful with aerosol generating practices, that when we are using our treatment rooms, we are ensuring that there's as little clutter out on the surfaces so that my support staff and I can clean down in between patients as quickly and as efficiently as possible. So if you know you're doing a restorative treatment, then there's good reason to have these out on the surface. If not, I would suggest that they're kept put away where
Inside,
any
yeah.
aerosol cannot reach them. So that's the only thing that we're doing differently. We're keeping the surfaces clean and tidy and not bringing these out until we know that they are required.
Well, that's really helpful, Gulshan. I mean, it's really important, and especially coming from a clinician's point of view, it's really helpful for having these tips around. Well, I would say thank you so much for your time. Yeah, and
Thank you.
hopefully, if there's any questions around, we will make sure that you get them. Thank
Thank
you
you.
so much for your time. Yeah.
No problem.
Well, that comes to an end for today's session. But if you have any queries relating to any of the topic we discussed today or any of the products shown in the video, please just send us an email on info@vita-zanfabric.com and you shall receive an answer the earliest. Till then, it's goodbye for now. Take care. Stay safe. Bye-bye.
Thank you.